Hello, am I audible? Hello?
Yes,
Yeah.
Shravanya, you're audible.
Yes.
Okay. Shall we start? How many of them are joined?
We have 70 participants.
Sorry, Aditi, you are on mute.
Hello, can you hear me?
Yes.
Yeah, we have 80 plus participants. I think we should start.
Yeah, okay. Good evening, everyone. So, IMA MSN Karnataka, in association with Rotaract Club of Bangalore, Seshadripuram, welcomes you all to the webinar on Hepatitis Can't Wait. So, myself, Saranya, I am a final year medical student from RRMCH Bangalore, and my colleague here, Aditi Shah, who's also a final year MBBS student from KIMS Hubli. So, IMA MSN is a network of students under the banner of Indian Medical Association to connect medical undergraduates all over the India with
Hello,
similar goals
Shravanya, you're
and
breaking.
purposes. We provide various opportunities for their personal as well as professional development and serve the community. Our mission is mainly to educate and provide guidance on future perspectives on medical career and in shaping the future of healthcare scenarios in India. So, Rotaract Club of Bangalore, Seshadripuram is sponsored by Rotaract Club of Bangalore, and it is a volunteer organization which focuses mainly on building a society a better place to live in. So, this club has been grown considerably since the year 2014 and has a graduate in engineering and communication, and from Reva University. She began her career as a volunteer in Rotaract Club and became the secretary in the year 1920. And currently, she holds the position of president and also has won the award Star Club Award of the same year. Welcome you, ma'am. Now, it's my intense pleasure to introduce our speaker for the day, Dr. Sandeep Satsangi, sir, who is an MD Internal Medicine and DM Hepatologist and a consultant hepatologist and liver disease specialist at Apollo Hospital, Bangalore. And he has the experience of more than 15 years with a special interest on management of complex hepatobiliary disorder, liver cancer, as well as liver transplantation. He served as an assistant editor of journal in clinical as well as experimental hepatology, won several awards for publicizing papers on acute and chronic liver disease. Warm welcome to you, sir, and thank you for joining us today.
Thank you, Saranya.
Yes, sir. So we can start the presentation.
Sure. So I'll just share my screen.
Yes, sir.
Yeah, so is it visible? Is it visible, Saranya,
Yes,
the
sir.
slides?
Yes, sir, it's visible.
Okay, hi. Good evening to all, and thanks for this wonderful opportunity. And it's lovely to see the youngster doctors actually taking the initiative on such an important topic. So I think I was invited by Aditi around, I think, a couple of weeks back to speak on hepatitis. I didn't even flinch to actually accept it, because I think the more and more we talk about hepatitis, I think the more and more we know and more our misconceptions about hepatitis actually solve. So I think in the next 10-15 minutes, I think that will be my attempt to actually address certain common causes of hepatitis and some basic misconceptions which are which revolve around hepatitis. So what is basically hepatitis? So in a very layman term, hepatitis basically means that your liver is having some sort of a swelling inside it. So there are several causes, but to make things very simple for us today, I think the most common causes of hepatitis would be, one is viral hepatitis, wherein certain viruses basically enter your liver and they can cause swelling in the liver. There are certain types of viral hepatitis which we'll be discussing shortly. Then the fashion of drugs. So, you might have heard in India, very common with even many of our relatives, wherein, people actually go to the chemist and pop in, tablets without realizing that they would have interactions and they would also affect your organs like kidneys and liver. So liver is one of the organ which takes a lot of brunt of this sort of an over-the-counter shopping of medications and self-medications, and it causes a lot of swelling in the liver. So toxicity of drugs, let it be any alternative medications related or allopathy related or anything related, any drugs which can cause swelling to the liver is called as drug-induced hepatitis. Then comes, I think, the most favorite of all, that is alcohol, which also can cause hepatitis. I think everybody in the audience would know that. Now I'm going to talk a little bit more on that to actually understand how much is actually safe and how much is unsafe and what would happen. And I think after the first three, I think the present epidemic for me, I think after COVID, is going to be related to fatty liver. I think more and more people are being aware now of this silent entity called as fatty liver. The problem is that the misconception. So, it's very common for me to hear people talk saying that, even I have fatty liver, even I have fatty liver, as if it's a matter of pride, and, would probably just do an LFT and see that, okay, my liver functions are normal, so probably my fatty liver is innocent. So it is not as simple. And now we are seeing more and more people who actually have fatty liver, in whom the fat is actually not innocent and is progressively causing liver damage and causing liver failure and liver cancer. So you can see this very interesting mannequin. This photo I had found when I was in Punjab. So this was a interesting mannequin, with a nice paunch you can see over here. So that's what actually is the situation, sad reality of most of the men today. So I think it's a wake up call that this sort of a paunch is something which is very, very dangerous. So first, let's start our discussion on hepatitis with viral hepatitis, which is from A, B, C, D, and E. So, to make it very easy, I think what we should remember is hepatitis A and hepatitis E are kind of similar. They are similar in the way that it can cause acute hepatitis. Now, what do I mean by acute hepatitis? So in acute hepatitis, what happens is that a virus enters your liver and causes a lot of swelling in the liver, but it will not damage your liver permanently in most of the situations. That is, it will leave your liver in few months to the maximum of 6 months. So you cannot have hepatitis A lasting in your body for more than 6 months. So this is what I mean by acute hepatitis, that it will enter your liver, cause damage. Most of the times a patient recovers, but few succumb to a very serious condition called as acute liver failure. But they don't go into what we call as chronic hepatitis. Now, what is chronic hepatitis? Chronic hepatitis would basically mean that the virus has gotten into your liver and is staying in your liver for more than 6 months. So hepatitis A and hepatitis E typically do not cause chronic hepatitis, they cause acute hepatitis. So how do you get this hepatitis A virus? I think and E virus, it's a very simple thing which you should remember, which I've highlighted in red. That is consumption of contaminated food and water and poor sanitization. So it comes from the feces of an infected person, and if you don't have a proper sanitization sort of a thing going on, or if the water is mixed in food and the food is not properly cooked, then a person can contract hepatitis A virus. Now what happens is when you get hepatitis A virus, so if probably 10 people get it, maybe 7 of them will have some symptoms, but they will be very mild sort of symptoms. And the mild sort of symptoms are going to be things like fever, some sort of weakness, fatigue. Some people can complain of nausea, lack of appetite. And in certain rarity, what happens is that few people have a very, very severe liver swelling, which can even hamper the functioning of the liver, what we call as acute liver failure. So this is a very grave condition which happens with a small proportion of people, but it does happen with hepatitis A or hepatitis E, that they go into acute liver failure, requiring very strict intensive medical therapy, few of them even requiring liver transplant, that is changing one's liver. So you can see the myriad of symptoms over here, just to make it very, very simple, for hepatitis A, and very similar things are going to even come up with hepatitis E. So in a mild situation of hepatitis A, you're lucky, you don't have to do much because your body is going to take care, your immune system is going to come up to save you, and it's going to kill the virus. And most of the times you don't require any specific therapy. Sometimes when the nausea or the lack of appetite or the liver swelling becomes significant, then you might require certain medical therapy. And as I mentioned, that if you don't do land up with acute liver failure, in which what happens is a person becomes very, very jaundiced. His entire eyes are going to turn yellow and he's going to become comatose. So this is called as acute liver failure. In this, what happens is you require intensive medical care, and in bad situations, even liver transplant. I think a very important point here to understand in this slide is going to be avoid listening to unnecessary devices. And by this, I mean that it is, I think I would say more than 95% of people who come to me with acute viral hepatitis would have actually heard so many things from people around that they would actually cause a lot of harm to themselves. One would be pop in certain immune boosters. Second would be strict dietary, protocols of not taking any oil, not taking any turmeric, or a strict sort of a diet wherein only liquid based diet or only fruit based diet is taken. So these sort of misconceptions actually are very, very bad. In very simple terms, I can tell you that there is absolutely no dietary restriction which is needed when you have acute viral hepatitis. And I remember one person actually was consuming 1 liter of sugarcane juice. So I don't know, I think there is some belief that people who take sugarcane juice, the liver is very, very good. So to make it very clear that you need no specific dietary restrictions, what basically happens is that if you have a significant viral hepatitis going on, you might have certain nausea and some vomiting sensation, which is why we tell that eat light food and don't take very, very deep, oily, fried foods. But that doesn't mean that the routine amount of oil which we use to make our routine food has to be avoided. So no dietary restriction is what you can think. In fact, what we want is high protein diet in people who suffer from viral hepatitis. I think this is a very important point from hepatitis A. So to prevent, if you understood how you get it, so the most important is going to be safe drinking water. And most important, if you're not sure about the water, then at least cook the food in which you're using that water properly, proper disposal of sewage within communities, and personal hygiene practices like regular hand washing before meals and after going to the washroom. I think this is a no-brainer for most of us. For hepatitis A, you do have a vaccine, and what basically happens in India is most of the adults actually would have been exposed to hepatitis B. So people like you and me wouldn't even know that we have got hepatitis A in the childhood, and probably would had some mild nausea, vomiting, and probably got recovered. So most of the adults are actually have antibodies against hepatitis A. So hepatitis A vaccine right now is mainly being used for kids in a 2-dose protocol, but certain adults also can take the hepatitis A vaccine. It is especially recommended to those folks from the Western nations, from Western places who are coming to India to a high risk sort of a zone. Coming to hepatitis B. So hepatitis B, in the initial part, I did tell you that there's something called as chronic hepatitis. So hepatitis B and hepatitis C are known to cause chronic hepatitis. Among hepatitis B and hepatitis C, these both can also cause acute hepatitis, but I think what we should remember hepatitis B and hepatitis C for is the chronicity. That is, they come to your liver, they get into your body, and they home your liver. They make liver your home, and their home, and they would stay inside the liver, and the time is usually more than 6 months. So this is called as chronic hepatitis B. If you see the methods of transmission in India, there's a study which actually shows that one of the most common methods of transmission is via mother to child at birth, which happens. Exposure to infected blood, sexual transmission, needle stick injuries, tattooing, and if you're not using the ink is not proper, then you can contract both hepatitis B, hepatitis C, and reuse of needles and syringes in persons who inject drugs. So I think this is one of the commonest mode I used to see in Punjab, that the youngsters who used to use drugs, who used to share syringes. So this method was one of the most common method implicated in spreading hepatitis C and hepatitis B. Coming to the symptoms, again, just like what if it causes acute hepatitis or chronic hepatitis. So acute hepatitis are pretty much the same symptoms which I told for acute viral hepatitis A. Even acute hepatitis B would have very similar symptoms. What would happen different in hepatitis B is that if it goes into chronicity, you're very, I would say lucky and unlucky. You're lucky because you don't have a lot of symptoms. You're unlucky because this virus is there to, permanently, near to permanently home your liver. What would happen is that it would go and sit inside your liver. And in many cases of chronic hepatitis B, it would not cause any damage to the liver. Now, what happens is as a person grows older or has other comorbidities like diabetes or any other immunosuppressive conditions, his immunity levels are going to go down. And suddenly this hepatitis B virus, which was inactive in the liver as a chronic hepatitis B will now become active. So the person still would not have any symptoms, and it is this patient in whom there are no symptoms, who is in chronic hepatitis B, the virus has become active. There will be active liver damage which will be going on. He will be completely unaware about it, just thinking that 5 years back my doctor told me that I was having an inactive sort of a chronic hepatitis B. He would be unaware about it, and would present after probably 8-9 years with a complete liver failure, or what we call as liver cirrhosis or liver tumors. So this is what is different with chronic hepatitis B and chronic hepatitis C. So for acute hepatitis B, again, just like what we discussed for hepatitis A, no specific treatment is needed. More than 90% of the adults actually clear the virus. So if today I get acute hepatitis B for hepatitis B virus for whatever reason, 90% of the times I would clear the virus. 10% chance that I would go into a chronic sort of a hepatitis B. But this would be different if you acquire hepatitis B as a baby. That is, if I would have gotten hepatitis B from my mother, then the chance that I would go into a chronic hepatitis B is much, much more. So, which is one of the predominant methods of transmission in India, which is why we all should be aware about, maternal screening, so that our child is safe. Once you go into chronic hepatitis B, unfortunately, with the currently available drugs, you don't have a complete cure for hepatitis B. But I think the most important point for us to understand is the hepatitis B virus, even if it is chronic, it should not cause any liver damage, is what we would want. So we have drugs which can completely control the division and the replication of the virus in the liver, and would ensure that a person with chronic hepatitis B does not land up with cirrhosis or tumor. And I think that is the goal of therapy, that you don't want your patient landing up with cirrhosis or liver failure or liver tumors. So for that, we have very, very good drugs. There's a lot of new drugs, and which is being tried in the early phase trials, with probably, with just a couple of pills in future, you might completely cure hepatitis B, but currently you can control the virus. And the second important emphasis on hepatitis B is going to be vaccination. So you can see over here that at birth, now it is a universal immunization. Everybody receives a shot of hepatitis B in the schedule, which is given over here. So you just have to ensure that, you're taking your kids to the pediatrician and following a proper vaccination. It is now routinely in all the government hospitals as well. For adults, I think the important point to understand is that you need to take the vaccine shots at this sort of an interval, that is 0, 1, 6 months. For example, if I take first dose that is 0 months, that is today, that is from 1 month from now and 6 months from now. So that is in a 3-dose protocol, what we give hepatitis B vaccine to adults. So the question comes that why should people be tested for hepatitis B in the routine screening? If you go to any hospital and get a routine health checkup done, they would most likely test your hepatitis B surface antigen, that is whether you have the virus or not. The reason, because one of the important reason is going to be that you won't have any symptoms. Majority of the times you don't have any symptoms. So it's a silent sort of a killer. So you need to find it out. So the testing is what has to be done, which will tell you that whether you're infected with the virus or not. There are good treatments available which will control the virus, which is very important. And most important, you can prevent the spread. For example, if a person is not aware about it and he transmits it sexually to his wife, the wife gives it to the children. So, you can just see that your entire family has gotten the virus. So just by a very simple method, for example, if I have hepatitis B and if my wife is taken the vaccine against hepatitis B, she cannot contract the virus. So as simple as that, just with basic strategies, we can ensure that even if we do have hepatitis B, our liver disease does not progress. And even if, we have hepatitis B, our family members around us are going to be safe with the safe and effective vaccine. So who all should get vaccinated? You can see a detailed list of people over here. But for me, I would say that all should get vaccinated without a doubt. Now, here comes a very important niche question, which comes that, I did take a vaccine, but I don't remember whether I'm protected or not, that I don't know whether I took all the 3 doses or not. In very simple terms, just go to any lab, walk into any lab and get these tests done for all the adults. That is anti-HBs titer. What happens is this is a marker of your protection against the hepatitis B virus. So for example, if I have taken a vaccine sometime, which probably even I don't remember, so I got myself tested for this anti-HBs titer, and if any value is more than 10, that means you would be protected against the hepatitis B virus. So for example, minus 500. So I know for a fact that I'm going to be protected against hepatitis B virus. So it's a very simple method. And if your titers come less than 10, that's when you have to just go to any nursing home sort of a thing and take your course of hepatitis B vaccine. This I'm talking about adults. For children, as I mentioned, it's a universal immunization. Whether you want it, you don't want it, your pediatrician is going to give your kid the hepatitis B virus. So very similar to hepatitis B virus is hepatitis C virus. Just like hepatitis B virus, it also spreads in the same methods, which we are going to discuss now, but very, very similar methods. Hepatitis C is more likely to go into chronicity when compared to hepatitis B virus. So here you can see that only 30% of the people can clear the virus spontaneously, but more than 70 to 75%, if you get hepatitis C, you're going to go into chronicity. That is, it is going to sit in your liver for over 6 months, and in fact for many, many years to go. And once it sits in your liver, it can cause liver swelling, which can lead on to cirrhosis or liver tumors. So again, you can see all these sort of very, very similar: sharing injectable drugs, unprotected sex, needle check injury, mother to child transmission. So hepatitis B and hepatitis C, very similar modes of spread, but one of the most important is going to be sharing of injections and tattoos. If you know, I think I have seen a lot of youngsters actually going and getting tattoos from, you know, places which are not, you don't know whether the ink is being changed or not, whether the needles are being changed or not. So, you know, this is one of a very common method by which hepatitis B and hepatitis C can spread. So be very, very careful with that. Unlike hepatitis B, now you have a complete 100% treatment for hepatitis C with very, very good drugs called DAAs, which are certain antiviral agents which we have. Earlier there was a problem that they were a little tad bit expensive. I remember that in the US, when this drugs actually came in first, the cost of therapy, the cost was somewhere around 18 rupees for 3 months. And you know, in India right now, if you see, the cost of therapy for 3 months is going to be somewhere around, if I'm not wrong, around 6 or 7,000 rupees. So that cheap. So in that sort of a difference, in India, you can get treated for hepatitis C. So it's a completely curable sort of a hepatitis, which we should make use of the drugs. In the prevention, again, the same sort of preventive measures which you have to take. Avoid going to places like, for example, in tattooing shops wherein you are not sure what sort of ink is being used. Avoid obviously drug abuse. Most of the times these days, the blood which is being given, it's properly screened. So getting hepatitis B and hepatitis C via that is very, very unlikely in today's world. Okay, so hepatitis D, I think this, I don't think we should discuss a lot, because this is something which is very, very uncommon in India. Just a simple word I can tell: hepatitis B and hepatitis D are best friends. If hepatitis B is not there, hepatitis D cannot survive. So if a person is having hepatitis D, he definitely is going to have hepatitis B together. So if you have a combination, hepatitis B plus hepatitis D infection, the liver disease is more severe and it can progress faster to what we call as liver cirrhosis. That is, you know, destroying the function and the structure of the liver, and also to liver tumors. Here you give an injection-based therapy, but it is very, very uncommon in India, so you don't have to worry about hepatitis D per se. Hepatitis E, I think we already spoke about hepatitis A. Very, very similar to hepatitis A, that it was again going to come from contaminated food and water, and poor sanitation. What we spoke for hepatitis A, and just like hepatitis A, it is known to cause acute hepatitis. So hepatitis E, for all practical purposes, there are certain. So I'm not going into in depth, but I'll tell you, in more than 99% of the situation, is going to cause acute hepatitis. That means it will come to your liver, it will cause some swelling in the liver. If your immunity is very good, it is just going to improve on its own. You might require some medical treatment, and you're going to completely recover permanently without any damage to your liver. Only in a few subset of patients, just like hepatitis A, I told you, can land up with acute liver failure when the liver functions drastically drop down. Even some people with hepatitis E, the liver functions will drastically drop down. They will have very severe jaundice, and they can have altered behavior and coma episodes requiring intensive medical therapy or liver transplantation. But by and large, most of the patients of hepatitis A or hepatitis E, the acute hepatitis variant, recover with just supportive measures, and the body's immunity itself takes care of it very nicely. So after that, I think comes the most important silent killer. I think talking about fatty liver and talking about alcohol, I think this is a very important point, which I think we all should be aware about, because I think if you go and screen each of your family members, I think I can be very sure that at least 20% of your family members itself are going to be positive for having fatty liver. So if you probably randomly in India, if you just scan 10 people, you're going to see probably 6 to 7 people might have fatty liver. The question is going to be that in which situation the fatty liver is innocent, that is the fat in the liver is innocent, or in which subgroup the fat in the liver is actually aggressively damaging the liver. So this differentiation is what is very, very important, because if the fat is just sitting in the liver without causing any liver damage, you're safe. But if the fat in the liver is actually damaging the liver, then you are at risk for progressive liver injury. So there are several methods by which your hepatologist is going to identify which risk you fall into. But if I have to make it a little simpler for all of us, you need to understand that if there is a very high obesity in the body, for example, your body mass index is anything more than 25, that's a risk factor. If you have diabetes mellitus, that's a risk factor. If it's you have hypertension, you have a risk for that. And you have bad cholesterols, that means there's a cholesterol in your cholesterol reports, there's something called as triglycerides, which is a bad cholesterol. If that bad cholesterol is more than 150, and you have something called as a good cholesterol, which is a HDL cholesterol, and if your HDL cholesterol is less than 40. So out of these five, so for example, if I have fatty liver and I have none of these five parameters, I have a good chance that my fat is innocent inside the liver. But if I have on ultrasound fatty liver, and out of these 5 points which I mentioned, I have 3 or 4 points, then I need to be very, I have to keep a very close eye that my fat which is in the liver might anytime go against me and start damaging the liver. And the biggest problem is this, that it's a silent disease. I think most of the diseases of the liver are so dangerous because they have no symptoms. I think pain is the best symptom which anybody can have. Unfortunately, liver swelling, most of the patients don't have these symptoms. Very occasionally, some people with severe fatty liver have a mild pain in the upper abdomen. Some people complain of little bloating sensation after eating food. Some people have altered bowel habits like constipation or diarrhea. But by and large, nobody would go to a doctor for such minor symptoms. And if by any chance they are in that group wherein the fat is damaging the liver, it is going to be a very bad ending for them. And another question is also going to be coming that how much of alcohol is going to be significant. Now, this point is very important over here, that non-alcoholic fatty liver disease. So the name only you can see non-alcoholic fatty liver disease. So how much of alcohol if I take, am I not qualified to be called as a non-alcoholic fatty liver disease? So usually it is said that people who are consuming less than 20 grams per day. So there might be many people, who just consume occasionally, very occasionally, and they have fatty liver. So then you call it as a non-alcoholic fatty liver disease. This is in comparison to a person who consumes alcohol actually daily in a significant amount. Significant would be more than 20 grams per day, and that person has fatty liver. So it would behave a little differently. So how much is basically significant? What is significant to make this distinction between non-alcohol and alcohol is 20 grams per day, both for males or females. Now, what is 20 grams? You can see over here that 30 ml of whiskey, that is a small peg, 100 ml of wine, or 240 ml of beer. This is equal to 10 grams of alcohol approximately. So if a person is consuming less than 20 grams in a day, then usually it is said that it is not going to cause significant alcohol related damage. Okay, so that is what it means over here. I am not suggesting that people go and consume this, because the problem in India, what happens is there is no person you're going to see only with one risk factor. So you're going to see a person who's going to be fat. You're going to see a person who has a sedentary lifestyle. You're going to see a person who's also consuming alcohol. So when you have one disease already going on in the body, the other disease is going to act like a catalyst in the progression of the other disease. But imagine that you have a person who is very fit, who walks a lot, who has a very good diet. If that sort of a person is taking up to 20 grams a day, probably he is not going to have a alcohol related liver damage, because his other risk factors are very well controlled. So what doctors would basically suggest is, something like a 10 to 20 grams usually in a week is something which is acceptable. But anything more than that, it is not, because you're going to have other risk factors. Most of the people who are listening to this would also tell that, okay, I'm a little fat, my BMI is, the BMI cutoff in India is going to be 23. Most of the people should actually go back and check their BMI. It would be more than 23. So any BMI actually more than 23, more than 25 is actually dangerous, but more than 23 is actually bad. And along with that, if you actually go on and consuming this sort of a 20 gram per day of alcohol, then that is going to be a significant consumption of alcohol for you. Alcoholic hepatitis. So in this, basically, you need to consume more. So what is the usual cutoff which is needed? Somebody who's consuming at least 40 to 60 grams of alcohol per day. So this is significant. This person, you cannot call it as a non-alcoholic liver disease, because he is consuming more than 20 grams. So for example, most of the people who actually have this problem consume 40 to 60 grams. You might be aware of such people in your family or in your friend circle or anywhere, people who consume 40 to 60 grams of alcohol per day. In them also, the first stage which happens is fat in the liver. So you can see that a person with a first will have a normal liver, would start consuming this amount of significant consumption of alcohol daily, fat would start going on into the liver, and they have fatty liver. And this fatty liver usually triggers a swelling, and that is basically called as alcoholic steatohepatitis or alcoholic hepatitis. In this, what happens is you have a severe swelling in the liver, and they present with very, very bad jaundice. So we see a lot of youngsters also, at the age of just 20, 32, and currently also there are around 3 patients admitted under me right now with alcoholic hepatitis, who just have consumed a lot of amount of alcohol over the last 3-4 years, and that has caused significant swelling of liver, and that causes severe jaundice, or fluid in the abdomen and fluid in the legs. And slowly, in these patients, if the abstinence is not there and they continue to consume significant quantity of alcohol, they are going to develop cirrhosis. And once you develop cirrhosis, you are at a risk to develop liver cancer. Okay, so you can see all the symptoms. Again, you can see all those things, the jaundice, which I was telling you, that the white of the eye would actually become yellow. You would start noticing that your urine is turning more yellow than what it is supposed to be. But most of the times it is very atypical symptoms and very mild symptoms, sort like, just nausea, lack of appetite. And once you actually land up with this sort of a severe jaundice or this sort of a belly, which you can see that is fluid in the abdomen, it's actually quite, advanced in the stage of liver disease. So here at this point of time, there are a lot of therapies wherein the alcohol abstinence and nutrition is a very, very important. And other than that, there are a lot of medical therapies which are available, which can help control this hepatitis in the liver and probably get the person back into a good stage. So you can see over here that you have a normal healthy liver, and whether it's a non-alcoholic or whether it's alcoholic, usually they start having fatty liver. And at this point of time, if you're actually very agile and you take it very seriously, you're going to stop yourself here and you're going to come back here. But if people again take it very, very lightly, like a chalta hai sort of an attitude, then from here, what you'd start developing is what is called as fibrosis. In fibrosis, what happens is your liver is becoming little hard slowly, and you have no symptoms again. And from here, in the next stage, you're going to have significant fibrosis, which usually goes into a stage of liver cirrhosis. And this is what it looks like. So you have a normal looking liver earlier, there is some swelling, enlargement of liver because of fat in the liver, and finally they go into a stage of a liver cirrhosis, which will in which what will happen is the liver will have all these nodules, and someday one of the nodule will turn malignant, that is cancerous, and they develop liver cancer. So this is what happens, whether it is viral hepatitis, chronic hepatitis, or whether it is fatty liver related hepatitis, or whether it is a liver cirrhosis due to alcohol. The end stage in which the damage happens will go on to cirrhosis of liver, and subsequently these patients actually either have liver failure, or few of these patients actually have liver cancer. So these are all the topics which I wanted to cover. I think the next set in the questionnaire, probably we can discuss more. Thank you.
Thank you, sir. You explained it so nicely. Like, even anyone who is listening to this right now, even if he's not a medico, he can understand it so nicely. So thank you. Thanks a lot.
Thanks, Aditi.
Thank you, sir. Thank you.
Guys, we'll go ahead for question answer session. Any of you have any question, you can put in the chat box and we'll cover it up. For now, we have prepared few questions, like the general questions which people ask. So other than that, you can ask any questions in the chat box. We'll be like seeing each and every question, and sir will answer most of it as much as possible. So there are few questions that people actually all the time ask. I would like you to answer a few of them. Like in general, if people are very shy to ask a few questions.
Yeah.
Like there are people, you actually I think explained it during the PPT also, like medications, when people are taking any medications or they're on other medications from before, should they make any changes for like if they are diagnosed with fatty liver or not?
So see, what happens is fatty liver is one of the condition which I was mentioning that in itself can lead on to hepatitis, or it might just be a silent observer in your liver and not causing any liver damage. Now, what happens is that people now, you have so many medications, so many supplements coming up, hitting the market, that, right from for slimming, people want supplements to have a glow on the skin. They want supplements for everything. They want supplements. And what happens is that in this aspect, many of these supplements can have certain substances which can be very, very significant and toxic to the liver. If you take it in very minor amounts, most of the times your liver is very strong enough to protect itself from these medicine-related damage. But sometimes what happens is, if your liver to begin with itself is very weak, for example, it has fat in the liver, or if a person was taking alcohol and the liver again is a little weak, on the background of a weak liver, if you're torturing it with certain supplements which the liver does not like, then typically they go into hepatitis. So that's the reason it is said that whenever, ideally I would say, whether you have fatty liver, whether you don't have fatty liver, no medication should be taken as long as it is not recommended, and as long as actually you feel the risk benefit ratio is actually favoring the benefit. But if especially you have a condition like fatty liver or any other viral hepatitis or anything else, then taking any other medicines, let it be allopathy or let it be any other alternative medications, it has to go via your doctor, who will give you a green signal whether that medicine is safe for you or not.
Sir, actually, like right now you said, like, and if there is a disease, like a person is having some other disease like diabetes or anything else, are there any like medications which should not be taken along with the fatty liver medicines, like when you're under treatment?
Yeah. So see, what happens is diabetics. If you talk about diabetics per se, see, I'll tell you, this is such a vast group that if we subdivide it, you're going to, on each I can talk for more than an hour. But if you talk about diabetes as such, what happens is in diabetes, if you see a very key study from South India which was done, that in diabetic population more than 80% suffer from fatty liver. If in a general population it is 45%. 8 out of your 10 patients having diabetes actually have fatty liver. The good point is all the medications which treat diabetes, most of the medications which are currently in practice are very safe even in patients who have fatty liver. Now, depends upon what stage of fatty liver you are in. If you're in a stage of only fatty liver with, without any liver scarring or liver cirrhosis, it is okay to go ahead and take all your routine diabetic medications, whatever is there, whichever medicine the doctor is prescribing you is safe. Now, what happens is if your liver is actually in a stage of cirrhosis and the liver functions have declined, that is where your diabetologist or hepatologist would become a little more careful in giving you certain medicines of diabetes, because certain medicines can put a little strain on the liver. So many of the times you will see that once the liver is in cirrhosis stage because of fatty liver, the diabetic medicines, the diabetic doctor would change it to insulin, or would change to certain very, very, very safe medicines. So if you have a starting stage of fatty liver, diabetes should not be a problem. But if you're in advanced stage of fatty liver, then the medications should be properly be guided by a proper diabetologist who is aware that the person is having fatty liver related liver cirrhosis or whatever other problem.
Thank you, sir. For all the participants, we have actually shared the post-event form in the chat box. Please fill that form, otherwise you won't be getting any certificates. Thank you. Continuing with the question, like a person asked another urologist we contacted actually, like for questionnaire, his child told us, like if I'm facing a digestion problems and frequency increase in loose motions, is it linked to liver?
So yeah. So see, what happens is your liver is very very intricately connected to your GI system, that is the gastrointestinal system. So when you have liver issues, it can result in very of these non-specific sort of symptoms of right from people complain of that I'm eating food, and now if I eat food, I feel that my stomach is bloated. I can't eat a lot of quantity of food. Some people say that after eating food, immediately I need to go to the washroom and use the washroom. So these symptoms can be connected to liver. These symptoms might not be connected to liver. The problem, what happens is that these symptoms are so non-specific that it might be connected right to some problems in the stomach, in the intestines, or to the liver as well. But to answer the question that whether if a person is having these symptoms, if you go to your physician who is going to evaluate you, doing a liver function test is definitely going to be on the cards, because sometimes when the liver is weak, when the liver is not able to metabolically help the body, the person can have these symptoms. So you need to test the liver to find out whether the problem lies in your liver, and if it is lying in the liver, then what is the a problem why the liver is getting affected, which is why these symptoms are having. But I'll tell you, in today's world, the commonest reason why that is happening is because of your fatty liver. If liver is responsible, majority of the times it is fatty liver which is causing the liver not to function properly and these symptoms.
Thank you, sir. Like there are questions like, will it affect my sexual life? I think you covered this in like viral hepatitis while discussing that. So if you want to talk more about it, or should we skip to the next question?
Sexual life. I think this is this needs more always. I think this is a very important topic, and I think it is less spoken about because of a taboo related to it in India. In the West, it's obviously much more different. Other than the fact that a person can transmit it to the partner, I think the important point is going to be in what stage of liver disease are you in. So one point is going to be that if you have viral hepatitis, you might spread it. Fine, that is understood. So I think very important point over there is going to be that, for example, if a person is suffering with hepatitis B, all you need to tell the person is that, if you're looking to marry or not, I mean, the point is that your partner should take the vaccine. That is the most important point to understand over here. And if the partner is taken the vaccine and her titers are more than 10, then it is okay. But if that is not the case, then, in the meantime, wherein she's taking the vaccine or he's taking the vaccine, obviously usage of condoms is important to prevent the spread of the virus. So this is in terms of that. And other is also going to be that if you actually have a significant liver disease, so what happens is only if you have hepatitis, it's not enough. But if you have hepatitis in which the liver has actually gotten involved significantly in terms of liver cirrhosis, then many of the times the impotence of the person gets, there's impotence. So then what happens is, you have sexual dysfunction. And that is a very sort of a emotional problem for men if that happens. So this is something which you need to understand, that there are medicines to tackle it. And if anybody is suffering with cirrhosis and is probably having this sort of an erectile dysfunction, impotence, I think they need to see their hepatologist. And there are good treatment modalities available to help them if the hepatitis has gone into cirrhosis and that is causing sexual dysfunction.
Since you brought up the medications, actually one of our participants have asked what medications can be given in severe fatty liver, and how will these help if the fibrosis in the liver has set?
See, I think if it's for I remember that just 3 days back, I spoke on the latest advances of non-alcoholic fatty liver disease, wherein I spoke for more than 60 minutes on the latest drugs. See, if this is like for medical students over here who want to know, there are a lot of drugs. So it's not so simple that, you would just use one simple magic drug. You need to find out what is going on in the liver in terms of fatty liver. For example, if the fatty liver is associated with what we call as insulin resistance, then you would target certain therapies to reduce the insulin resistance. And one of the most important targets is going to be the PPAR pathway. So if you target the PPAR pathway, I think all of you might be aware about a drug called pioglitazone, which targets the PPAR gamma pathway. So similarly, you have a drug called as saroglitazar, which targets the PPAR gamma pathway and also the alpha pathway. Again, that is known to reduce the swelling in the liver. And if your patient of severe fatty liver has gone into a stage of fibrosis not amounting to cirrhosis, so from fibrosis to cirrhosis, there's a long stage wherein you have F1 fibrosis, F2 fibrosis, F3 fibrosis, and F4. F4 basically means cirrhosis. So in between, if you have fatty liver and your doctor diagnoses F2 fibrosis, there's a new drug which has come called as obeticholic acid, which can be given as an anti-fibrotic agent. So there are a lot of drugs, I think. So the point which we need to understand is going to be not only in terms of your medications, but what is leading, which point is a significant pointer. There's a drug called as tocotrienol, which is nothing but a specialized form of vitamin E. So vitamin E also is known to reduce the oxidative stress in the liver and also reduce the steatohepatitis, as a swelling in the liver. And the most important therapy for fatty liver, I would say the bottom line is going to be lose weight, do 45 minutes of brisk walking every day, and reduce your calorie intake. People have a misconception that if I have fatty liver, I have to reduce fat in the diet. That's absolutely wrong. If you have fatty liver, you don't only reduce fat, but you reduce calories. So I know people that who have stopped oil, but they take this much of rice every day. That is not going to work, because that is calories, and extra calories in your body is going to convert into fat. So you need to reduce calories from all ways, all sources, from sugar, from Coca-Cola, Limca, Pepsi, from rice, from whatever source it's coming, the calories in your diet has to come down, and you need to work out and at least put in 45 minutes of workout daily, at least a brisk walk, and that will help target your fatty liver for a long run.
Thank you, sir. That is one advice all the people who are trying to lose weight also should follow, I think. These are the things which have been talked about before also, but the COVID is something very recent, and all of us want to know, like, how is COVID like going to define the hepatitis and the liver diseases in future, sir?
Yeah. So see, COVID, I think now more and more we get to know about COVID. I think there's a lot of things now we are aware about COVID-related hepatitis. In fact, I recently written a chapter on this only entity of COVID-related hepatitis, because what happens is that we need to understand that COVID per se, the virus, can cause hepatitis. Not only the virus, but the drugs which you're taking for during the time of COVID can cause hepatitis. And most importantly, that when you have COVID, we all know that majority of the people recover spontaneously because of your immune system acting. Sometimes you have this immune system which goes aberrant and goes and involves your liver and damages your liver. So it's an immune mediated hepatitis. So there are various ways by which a COVID can cause hepatitis, right from the viral attack to the immune mediated attack to the drugs which you are taking to treat COVID can cause hepatitis. So again, your doctor is obviously going to find out that which of the probable reason is acting, whether it is connected to the drug, whether it is connected to the immune mediated action, whether it's connected to the virus per se, which is causing the involvement of liver and causing the hepatitis. And based on what is the reason, you can actually treat it very nicely. Most of the times I can tell you that the COVID related hepatitis is reversible, and it is acute type of hepatitis. That's not chronic. And there is at least no data as of now that it is chronic, other than in few situations wherein COVID infection can trigger an autoimmune phenomenon in the body, and that autoimmune can become a chronic hepatitis. But most of the times the COVID related hepatitis is an acute hepatitis, and once the whatever reason which is causing hepatitis, like the virus or the drug, is taken care of, then the hepatitis usually settles down in COVID patients.
Uh, Related to COVID only, sir, there were few debates going on like past 1 year when medications and all started. Like some medications given for COVID is causing hepatitis, like liver damage and all. Is this true, or is this just a myth?
So it is true, but I would say, see, any drug which you take has a potential for hepatotoxicity or nephrotoxicity right from the basic antibiotic what we take, which is the reason why I think we spoke about the fact that you always need to take a medicine when you feel that the benefit is more than the risk. If I take a medicine wherein the risk is more than benefit, then that doesn't make a sense. So similarly, for example, the most debated drug, which I think most of the non-medicos also would be aware about, is something called as remdesivir. So when remdesivir came in, there's obviously a lot of hue and cry about the fact that it can cause liver damage. So it can cause liver damage. Even I personally have seen it. But having said that, you have to use it in the right stage of COVID. I have seen people that after third week or fourth week of COVID, where actually your lung involvement is not because of the virus, but because of the immune dysfunction where it is happening. And there also we are using remdesivir. So if remdesivir is being used in a wrong clinical setting, it can cause hepatotoxicity. But imagine that remdesivir is actually being used in the viral phase. Then it is a good drug. Definitely, there's no doubt that there are a lot of data pro and against remdesivir. But this is one of the drug which I'm telling you that remdesivir is being associated with hepatotoxicity. So is tocilizumab, which is the other drug which is used. What happens with that other drug is that it can reactivate hepatitis B inside the liver, and the hepatitis B can set in because these are immunomodulators. So what can happen is your other occult hepatitis can become overt during this stage. So the answer is that yes, it can cause, but I would say I don't think there's any reason to worry about it because even an antibiotic for sore throat, even an antibiotic for any tonsillitis or any other problem also can lead on to hepatitis. So I don't think per se we need to worry that, oh my God, if I get COVID, I'll have to take that drug and that will cause hepatitis. The answer is no. If the doctor feels necessary that a drug has to be taken, it has to be taken. There is no doubt in that. But having said that, yes, your doctor would be keeping a very close watch on the liver parameters if these drugs are being used.
Thank you, sir. There are few people who ask like, when should we go to a doctor? Like in our Indian culture, there is not a thing like they'll go to the doctor at the first sign of the symptom. They'll wait for it to grow, and like they'll be like, the cost for the tests will be like so
Yeah.
much. So which test should be done and all.
Absolutely.
So
See, I think this is obviously a problem in an Indian setting wherein you're always going to have financial problems. So I think the simple step is going to be that identify risk factors. For example, that, if I know that I'm a diabetic person, or, if I have hypertension, or if I know that my BMI is more than 25, for example, I'm at risk for fatty liver. I do know that. So when I know that I'm a risk for fatty liver, I have to make sure that I'm actually assessing my risk, whether that fat is actually innocently sitting or whether the fat is actually causing liver damage. Number two point, I think very interesting point, I think also for us to understand is people with fatty liver don't die of liver related death. They die of heart attack. So the commonest cause of death in a patient with fatty liver is actually not liver, but heart. So people who have fatty liver, it's like a mirror saying that these people will have more heart attacks. So definitely when you do your workup, you might find so many other things that your cholesterols are way up, and your doctor might put you on very correctable measures which might prevent you from actually having a heart attack in future. So if you have risk factors, definitely get tested without a doubt. Number two is going to be that if you have, for example, in your family somebody suffers from hepatitis B, you got to know that maybe your mom was diagnosed with hepatitis B but then she recovered out of it. That's a warning sign that you should actually go for a testing. And again, all young doctors, all the time, we are exposed to all the cases of hepatitis B or hepatitis C. So periodically getting surveillance done, because you're not going to have any symptoms. Periodically getting a surveillance hepatitis B, hepatitis C testing is going to help you to know. And I do know of so many healthcare workers who don't even have an idea about anti-H based titers, and it completely surprises me when I ask them, okay, what is your anti-H based titer, to doctors, and they'll be like, okay, sir, we have not tested it, I don't know whether it's more than 10 or not. So I think the first thing is going to be that, for people who are at risk in risk professions like sisters or doctors should get the anti-H based titer done and would see whether it is more than 10 or not. So such group which are at high risk should get tested for viral hepatitis. But I think now more and more you're seeing that if you go to walk into any hospital, you have very, very nominal, on a very nominal price, you have certain packages which will include CBC, which will include thyroid test, which will include LFT. So doing those tests once in 3 years or 4 years, especially if you have any of these risk factors, is going to unmask so many things which can, as a prevention work for you and, help you prevent having a disease. That's the reason now we are seeing so many people actually coming for preventive health packages, just coming and, wanting to assess their hepatitis B and hepatitis C status. And daily I get one patient who comes only for a routine preventive package and is found to have hepatitis B positive. So, that's an actually advantage for him, because now we can treat that patient before him going into a stage of chronic hepatitis, related cirrhosis or liver cancer.
yes, sir. Thank you. That was all the questions that we had gotten. There is one question from one of our participants. It's a long question. I think, like, if you can shorten it and answer, like, how exactly does alcohol cause fatty change in the liver? If you can shortly explain it to them.
So I'm not sure again whether this is a doctor or whether this is a non-medical, because that again will, with my entire pathophysiology of the disease, I don't want to make it too complicated. But see, I'll just tell you in very simple words, that when a person takes alcohol also contains calories. In any person, whenever he's going into a stage of alcohol-related liver cirrhosis, goes through few phases of liver disease. In the first phase, whenever a person consumes a lot of alcohol, there is a lot of leaky gut. In very simple words, if there are medical students here, would understand that you have tight junctions between your epithelial cells of the intestine. So whenever you take alcohol, they become loose. And when they become loose, you have bacterial translocation happening. And so all the intestines would have bacteria. Normally we have bacteria in our intestines. These bacteria would actually pass from from the tight junctions, and they would emit something called as lipopolysaccharides. They would go in the liver and basically cause all these hepatitis related changes. If you talk about alcohol, in the first stage, what happens is the intrahepatic triglyceride content goes up. So that triglyceride content will form small steatosis inside, that small droplets of fat inside the liver. And that initially is again going to be innocent. So many people who actually consume alcohol, if you do a scan for them, you're going to see that there's an innocent fat which is sitting in the liver. The LFT test is going to be completely normal. But if that continues, those lipopolysaccharides which are coming out from the intestine would actually go into the liver and would trigger an inflammation inside the liver. That is, inflammation means a swelling in the liver. And they then go into, from alcoholic steatosis, they go into alcoholic steatohepatitis. So those intrahepatic triglyceride contents would get damaged, and they would, under the oxidative stress and under bacterial translocation, would incite a swelling inside the liver, and they would go into alcoholic steatohepatitis. And from there, if you again continue to consume alcohol, that's a downward spiral of actually having fibrosis, and from F1 to F2 to F3 to F4 into cirrhosis.
Thank you, sir, for explaining it in such a short way for a non-medical also to understand it. I think the question was from a non-medical student.
Oh, non-medical.
Yes, sir.
I hope he understood. I mean, I could have made it more simple that way then.
Yes, sir. There is another question: will AST and ALT be elevated in early liver disease? I think this is from a medical student.
So see, yeah, definitely. I think if I want to go into very basic, the problem of asking a hepatologist is going to be this, that I can give 10 different answers for one particular question. That's a problem. But if I have to make it very simple, then yes, AST ALT is a marker of liver damage, and when there is liver damage, AST ALT bounds to go up. So usually in an Indian setting, the cutoff is taken as 40 for both AST and ALT. Ideally, you should have a AST ALT less than 30, but anything more than 40 is considered as definitely elevated. So usually what happens in early liver disease, the answer is that you might not actually have an elevated AST ALT. So if you take any of the examples, for example, many of the people in probably this audience also would be taking alcohol once in 3 days, once in 4 days. You actually go and get yourself tested, your AST ALT is going to be normal. But your liver is definitely under some amount of stress. Probably there will be some amount of triglycerides, some amount of alcoholated fatty liver. The person might also be obese, so that even that might be contributing to the fatty liver. So the AST ALT in the very, very early stages might not be elevated. And another thing which happens is the damage which happens because of any of these entities is not continuous. So you might have a damage and then it might keep quiet. So if you do the testing when it is quiet, you might see that AST ALT is normal. But you might miss that, the previous, probably the last week, there was some damage which was happening in the liver because of that particular reason, whether it is fat in the liver, whether it is chronic hepatitis B. So the damage never happens right in a straight way. It happens in a yo-yo sort of a phenomena, which is why usually a repeat testing is done to understand that whether your AST ALT is actually a good marker for your liver disease or not. So this question is very important for people who have fatty liver, because I know people with fatty liver actually go get a LFT test done and see that, oh, LFT is normal, and they think that, okay, my fat is not damaging my liver, I have nothing to do, my BMI is 30, let it be, I'll go and consume sweets and I'll not lose weight. So this sort of a thing is going to come just based on looking at the LFT report. So that is wrong, because what happens is that in spite of your AST/ALT being normal, if you do a liver biopsy in such patients, you are going to see hepatocellular ballooning. Okay, that means that the hepatocytes will become swelled up and they will inside have a chemical called as Mallory hyaline. So what this I'm talking about in fatty liver, not even connected to alcohol. I'm talking about just non-alcoholic fatty liver disease, and that is going to trigger swelling. So around the hepatocytes, you're going to have swelling because of that particular thing. So this is a complete continuum wherein you're going to have issues connected to the damage, and if the damage is significant, then yes, you're going to see that the AST/ALT levels are going to blip upwards.
Thank you, sir. I think that's all for the questions. There are no more questions from the participants. So we have the president of Rotaract Club who will be speaking for 5 minutes, if you are fine with it, sir.
Sure, please.
Yeah, thank you, sir.
Is Lavanya ma'am here?
No, I don't think she could join.
Okay, sir. Srinidhi sir is here, who's also
yes.
Who's a past president. He can speak.
Thank you, Dr. or to be Dr. Sharanya, and really wonderful to listen to you, Dr. Sandeep. It was a great session. Even though we are not from the medical background, we could get a lot of insights. So before I could proceed, I wish to place recognition and welcome some of our seniors and stakeholders of Rotaract Club of Bangalore, Seshadripuram, who are here. Our club advisor, Rotarian Meerabai Shankar ma'am, is here. Thank you so much, ma'am, for joining us, and thank you for your support which you provided. I can also see past president, Rotarian Srinivasa sir, who is one of the prominent figures in the polio project of Bengaluru and the other 7 districts of Karnataka. Thank you so much for joining. and Professor Sophia Rani ma'am, Principal of Vishwasai College of Nursing, who is also here, Past President Apurva, Rotractor Rakshit Secretary, Rotractor Shushma, uh, Community Service Director, and all the other Board of Directors of Rotract. Thank you so much for helping us out and helping the entire team in getting a good promotion for organizing this particular event. So on behalf of Rotaract Club of Bangalore, Seshadripuram, I wish to place my thanks to IMA MSN Karnataka, especially Ms. Sharanya Gopinath for getting in touch with us and giving us an opportunity to collaborate with you. Through this particular collaboration, I'm pretty sure that many who are related to both of our organizations have got a lot of insights, especially when it comes to health and the other related aspects. So here, I would like to take a minute or two to talk about Rotaract Club of Bangalore, Seshadripuram, and one or two of the projects which we have been conducting. So Rotaract is a youth wing of Rotary, and Rotaract Club of Bangalore, Seshadripuram, initiated in 2014. And since 2014, a lot of community service activities have been conducted by the organization, which includes some of the major projects. I would state as projects 3, which is about welfare and well-being of women. It may be menstrual health and hygiene related awareness projects, or it may be women empowerment, women safety, etc. There are a lot of projects which are taken up under the aegis of projects 3. We also have projects such as Ved Tattva, which is about showcase importance of Ayurvedic medicines throughout the world. We have international collaborators as well for these projects. We have projects under the professional development avenue such as Anveshana, where we showcase research and innovation related projects. And on this platform, I wish to invite you all to the 4th annual Dr. APJ Abdul Kalam Memorial Lecture, which we are going to hold on 27 July at 5 p.m., which would be on nanotechnology, research and innovation. So the reason for me to talk about our organization is not to boast about the projects which we do, but to showcase that this is a time where the youth need to come to the field of service. I am really glad that IMA MSN is doing a lot of projects with respect to the health and other aspects. And we are also going hand in hand with such organizations helping out the society in many ways possible. So it is a call for join the service related organizations. The world requires you. Let us make the world a better place to live in. So change starts from within, we say. So be the change which you wish to see. Create awareness amongst all the possible, whatever aspects we could create awareness on. It may be health related aspects, or it may be to, okay. Am I not audible?
You're audible, sir. You're audible.
Okay, sorry for that. Uh, be it health related aspects, or it may be related to cleanliness drive, or it may be related to breaking the myths in various aspects, maybe related to menstrual health and hygiene, or it may be COVID, anything as such. So I call the youth to come up and showcase that the youth can bring about a lot of change, just like how the youth here have organized this particular program. Very happy to see that more than 150 people have logged our youth. So probably from today, we would be talking more about hepatitis, as Dr. Sandeep was mentioning previously. Anything which is related to the basis of sexual or sexual related diseases or sexually transmitted diseases, we are very afraid, or we are very embarrassed to talk about it. But we have to understand that if it is something which is related to us, we need to speak up then. So by talking, we would be able to prevent such kind of diseases, and also create an awareness amongst many that such diseases exist and also can be prevented or cured. So once again, I wish to thank the IMA MSN Karnataka for giving us an opportunity to collaborate for this wonderful topic. If not for you, probably you wouldn't have had this opportunity to reach out to the public and create an awareness on hepatitis. And thank you, Dr. Sandeep sir, on behalf of the entire Rtr Lavanya. I wish to thank you to Sharanya. Thank you.
Thank you, sir. It was wonderful. And Sandeep sir has to leave now. So thank you, sir. It was great. It was a great session, and we all enjoyed it. And it was really, you made it very simple for both medicos as well as non-medicos here. And really, thank you, sir. It was wonderful meeting you.
Thank you, Sharon. Thanks for this wonderful initiative. Keep it up.
Thank you.
I'll take your leave then, okay?
Yes, sir. Thank you, sir.
Bye. Good evening. Bye.
Bye, sir. Sharanya, should we end the meeting? Nitin, is there anything else to be done?
No, we can end the meeting.
Yeah, end the meeting.
Yeah, if everyone can switch on the videos for a minute, then we could take a screenshot.
Everyone, please turn on your videos so that we'll just take a pic.
Yeah, done.
Thank you, Nitin. Thanks, guys, for joining us.
Thank you, everyone, for joining us today.
Thank you, ma'am.
We're excited for more such sessions in the future.
Thank you. Thank you.
Okay, bye, guys.
Bye, ma'am.
Bye, ma'am.